I'm Sister Rita Murillo. I've been a member of the community for 59 years, and currently I live here at Annunciation Convent. My ministry is I'm a public defender in juvenile court, and it has continued during this time period, so I've been very busy.
I'm Sister Karen Stoila, the former development director of the congregation for 21 years, so it's great to say hi to old friends. I currently work at Casa San Jose in the Beachview section of Pittsburgh. It's a ministry founded by the sisters. Sister Janice Vanderneck is the founding director. We have been very, very busy since the pandemic began in March, providing necessities to the Latino community as they get no help from the government or any kind of assistance other than the generosity of people.
I'm Sister Barbara Czyrnik. I am currently doing volunteer work at Allegheny General Hospital. We are here at Annunciation. We have been here for over 100 years. We moved from the convent, which is in front of us, to the rectory, which is behind us. And we moved here in 1994, and we've been here since. And it's been a wonderful place to live in this neighborhood. We serve the people in the neighborhood, and we're very involved with the Pittsburgh Project.
As a public defender in juvenile court, unfortunately, children always get in trouble. So it's certainly not been a hiatus of cases. It's just been a constant flow. For the most part, our cases are being held remotely. And the cases that I'm doing currently are detention hearings and cases that would not generally require a child to be placed outside of their home. So it's keeping me very busy. Some nights I'm still going long. After supper, I have to go back up to the computer to finish up. But it's also wonderful to see the children respond, because we do it on FaceTime and Teams, and it's like, oh, okay, because they're happy to see a person, and so that's really been helpful.
Formerly, I was on the leadership team of the Sisters of St. Joseph, and when I left leadership, I was looking for opportunities for volunteering, and I am currently helping at Allegheny General Hospital in the palliative care. Normally, we used to visit in the hospital and visit the patients and their families, but since COVID, we haven't been able to enter the hospital. So we're making telephone calls from home, supporting families, supporting some patients if we have a phone number. So we're trying to give support and to accompany them from a distance. And they're very grateful that people are thinking about them and they're praying for them and walking with them at this terrible time, because not being able to be with their loved ones is extremely difficult, and it's just so hard for them not to be with them and to accompany them in their last days.
I think we do have a consciousness in our house about praying for people who suffer in the pandemic, because we are so intimately involved with individuals, Barbara with people who are dying, myself with people who are in extreme need, Rita with people who don't have opportunities for maybe other kinds of outlets. And so we are very conscious during our evening prayer after supper to pray for people in our families, people in families of the sisters who we know, people in our ministry settings, as well as people that we don't know.
And our prayer really is so, it all comes out of our relationship with our clients, our relationships with our family, with members of the community, and we take it very seriously. And what's wonderful is how people recognize that, even though we've been, homebound in many ways, we still have those connections, and so we're really grateful that people recognize it and are willing to, to ask us, will you pray for? And we do, and we send it out to the whole community. And there's something that really gives people a sense of calmness that comes from knowing that they're not just remembered by one individual, but by all the sisters and by name, because we send in the name, so it really helps.
I guess I've never been so touched by people's lives at that level, that deep level of pain and grief. And so I bring them to prayer every day, and I do promise them my prayer, that they will be with me, and I will take them to God. So I know there's energy there, I think from all of us, the energy that one feels in prayer, that we are connecting with so many people.
And we have one more sister who lives here. Sister Paula Drass lives here. And in fact, she's busy and they're working right now. She does spiritual direction. And it is, I mean, she's doing most of it either by Zoom or in some kind of video conferencing. And, you know, when things eased up a little bit, a couple people, because of their situation, were able to come here. But, you know, she is just so involved in the spiritual lives of these people. And you can just tell what a difference it even makes for her.
Well, I know for myself, a favorite saying in the community is always, "This too shall pass." And I believe that. And even St. Teresa of Avila, you know, all things change, only God remains the same. And I certainly think there's a lot of hope now with the vaccines and the progress that has been made and the way that people have put themselves into the science and the work that has to be done, you know, to find some way to slow the spread of this virus and hopefully eradicate it, and a lot of breakthroughs in science.
For me, a sign of hope are the people in the hospitals, the doctors, the nurses, the staff, who have worked long, hard hours to be with people and to take care of them, knowing that their family's at home. Like one nurse said, "When I go home, I can't hug my children." And so I talk to them a little bit, put them to bed, and then I'm back at work. So they are certainly dedicated in giving so much of themselves. I think of their goodness is a really big sign of hope for me.
Just be assured that there are people who care. Because right now we really remember, and every day at dinner time when we just name some people that we're praying for, we also ask for those who have not asked and who are in need of prayers. Because some people just don't recognize that there's somebody who's going to listen. So, you know, we just invite you, don't be afraid to call. You know, send a call, call the Mother House, call one of our convents, and the sisters will pray. There's no ifs and buts about it, and it will be shared.